Hypertension, also known as high blood pressure, can damage your blood vessels and, with time, may put you at greater risk of a heart attack or kidney disease. Sometimes a condition of hypertension does not carry any symptoms and might go undetected for many years. A large number of the world's population has high blood pressure, which is considered the leading modifiable risk factor for heart disease and early death. A healthy, balanced diet plays a major role in blood pressure control. So if you have high blood pressure, you may be prescribed various medications to help control it. Also, you will be advised to change your lifestyle by exercising more and eating healthier. One thing that is sometimes not mentioned is getting adequate magnesium. Magnesium is a key mineral for regulating blood pressure. So how does magnesium lower your blood pressure? Magnesium helps lower blood pressure in several ways. It has a key role in over 300 enzyme reactions and aids in many system functions. Magnesium helps regulate hundreds of body systems, including blood sugar, muscle and nerve function, and also blood pressure. We need magnesium to help blood vessels relax, for bone development and energy production. It also increases nitric oxide levels. It reduces endothelial dysfunction, which is an imbalance between contracting and relaxing factors in blood vessels, and acts as a natural calcium channel blocker. Magnesium is a mineral that is needed in higher amounts compared to other trace minerals. It is essential to maintaining good health. The National Institutes of Health reports that most older adults in the United States do not get the adequate amount of magnesium in their diets. Usually, age is a risk factor for high blood pressure. Magnesium deficiency is likely involved in worsening blood pressure issues as we age. Extreme magnesium deficiency is very rare. You should avoid magnesium supplements if you have chronic kidney disease, because this can affect magnesium excretion and cause it to build up in your body. Just know that too much magnesium from a supplement or from magnesium-containing drugs, such as laxatives, may cause diarrhea. But there are no known adverse effects of magnesium intake from food. Magnesium has many roles within the body, most predominantly in its relationship to enzymes. Here are a few of its major roles and health benefits. The mineral magnesium helps support healthy heart function. Its main function is in relation to blood pressure. Many research has shown the role of magnesium and cardiovascular health suggests that magnesium aids in lowering blood pressure in healthy adults with acute higher blood pressure. Magnesium has a role to play in bone formation. It influences the activity of important bone cells, such as osteoclasts and osteoblasts. Also, it may increase overall bone mineral density, especially in postmenopausal women. It has a regulatory role when it comes to the water-soluble element vitamin D. Diets that meet recommended levels of magnesium have shown good overall bone health. Magnesium plays a role in regulating metabolic functions. High blood sugar levels causes a diuretic effect in the body, such as frequent urination. This causes many water-soluble minerals and vitamins to be depleted, leading to magnesium deficiency. So rather than taking a supplement, the best way to make sure you are getting enough magnesium is to increase your intake of certain foods. Make sure to speak to your nutritionist or doctor first if your magnesium levels are low. Here are a list of foods that contain magnesium: plain yogurt, kidney beans, black beans, green vegetables like broccoli and spinach, chicken, beef, avocados, oatmeal, bananas, apples, carrots, soy milk, peanuts, almonds, peanut butter, potato skins, chia seeds, pumpkin seeds, whole grains, such as whole wheat bread and brown rice. Remember, the best way to get enough magnesium is from food. The variety of magnesium-containing food is high enough to make it easy to reach a daily recommended dose, unless you have problems with food intake. There are studies and evidence that not getting enough magnesium can worsen your high blood pressure. Magnesium supplementation is unnecessary and potentially dangerous if you are not deficient. Magnesium supplements can interact with some blood pressure medications. Potassium is another mineral that helps lower blood pressure. Foods that are rich in potassium are important in managing high blood pressure. So the more potassium you consume, the more sodium you lose through urination. Potassium relaxes the walls of the blood vessels, lowering blood pressure. And there have been a number of studies that have shown an association between low potassium intake and increased blood pressure, and also a higher risk of stroke. Increasing your potassium through diet is recommended in adults with high blood pressure. But it's important to know that potassium can also be harmful in patients with kidney disease or any condition that affects how the body handles potassium, or for those who take certain medications. Even though potassium can lessen the blood pressure raising effects like sodium, it is important to discuss whether or not to increase your intake of potassium with your physician or healthcare professional. It is important to know that overly high levels of potassium can lead to dangerous, irregular heart rhythms. Here is a list of potassium-rich foods: tuna, avocados, lima beans, prunes, potatoes, raisins, dates, spinach, tomatoes, grapefruit, apricots, oranges, mushrooms, kiwi, butternut squash, sweet potatoes, cantaloupe, and nectarines. It is a good idea to look for foods to consume that is high both in magnesium and potassium, such as bananas. A person who suffers from high blood pressure can manage it by making some lifestyle changes, such as reducing salt intake, managing stress levels, getting regular exercise, eating a healthy, balanced diet, quit smoking, and minimizing the intake of processed and canned foods.